Hey everyone, Dr. Adam Hughes here. Hope everybody's having a great week. Just wanted to get in a quick wellness video talking a little bit about some thyroid function and some adrenal function. A lot of people that we talk to and that we see, they come in and they're wondering about if they have any type of adrenal fatigue problem, or adrenal fatigue syndrome is another type of diagnosis that gets tossed around quite a bit. And I see adrenal fatigue syndrome as more of a state of physiology, more so than an actual disease process like, Addison's disease or other types of actual adrenal disease processes or tumors. But adrenal fatigue syndrome can be more of, like it says, a syndrome. It's more of a state of physiology. So of course your adrenal glands produce major stress hormones. So when you're stressed out, your body secretes these hormones like cortisol and epinephrine and norepinephrine that help you deal with stress and help you survive. Now, of course, these hormones can get produced, way too much, or sometimes they get produced so much that your body has a hard time making them again. So you can develop these ups and downs when it comes to adrenal gland production. And of course, adrenal gland production goes back to specific neurological function as far as your hypothalamus and your pituitary glands. And also it will have a major impact on thyroid function. And it'll do that in a few different ways. So if you're majorly stressed out and your body is producing too much cortisol and it's constantly pumping this hormone out, that can affect your body in major ways and affect the thyroid. So on the one hand, that can actually suppress the hypothalamus and pituitary axis. So how your hypothalamus and how your pituitary gland are actually communicating, with your adrenals and with your thyroid itself. So it'll suppress thyroid function in general. Now it can also decrease the body's ability to convert T4, which is, an inactive thyroid hormone, into a usable T3 hormone. Okay, so T3 is the active form that your body has to convert from T4 for your cells and your body to actually be able to use the thyroid hormone. It has to be converted into T3. So high amounts of cortisol, though, and high amounts of these stress hormones can suppress that conversion. Okay, and finally, it can create high amounts of cortisol, which will create high amounts of what they refer to as thyroid resistance. So in other words, even if your body is able to make the hormones and convert them into T3, into a usable form, those hormones can get to the cell, and because of the inflammatory process that high amounts of cortisol can create, so it creates a lot of inflammation, a lot of excess inflammation, that inflammation will damage what are called receptor sites on your cells. Okay, so that's the part of the cell that the little hormone gets to. It's like the doorway, and it has to go through the doorway to get into the cell. But because of that high cortisol and high inflammation, those receptor sites are damaged. So it's like you're making the right amount of hormones, they're getting converted, everything is going through that whole process, yet the hormones aren't getting used because the little doorway is damaged. The thyroid receptor sites are damaged. So that's just another way that you can develop hypothyroid symptoms even when you look at your blood work and maybe your TSH and even the T3 and T4 levels look okay, but you're constantly dealing with the fatigue and the blood sugar problems or the brain fog and joint pains and all those types of things. You keep wondering why you never get better. Well, that can be another one of those reasons that you have to really dig into in order to figure out what's really going on and what else do you have to support besides just thyroid function. What else can you do if you're dealing with these types of adrenal imbalances or cortisol imbalances? And it's just about taking a step back and assessing, why that's happening to begin with. What are the major stress factors that you could do something about? And people get tired of hearing about it, but it really is about managing the specific types of stress that are creating these types of imbalances. So I hope that makes sense. And as always, if you like this video, please like it and share it with somebody you care about that may be dealing with adrenal fatigue syndrome or dealing with different types of thyroid problems. And of course, if you have questions or comments, leave them down in the comment section, and we'll talk to you all real soon. Thanks.